Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. Today, we're going to talk about Lima Dental Associates. Therefore, in the studio with us is Dr. Risolvato. Good morning to you, sir.
Good morning, George.
And how are things going?
Well, things are going very well. Actually, I'm sleeping a lot better nowadays, George.
All right, you got me curious now. I didn't realize that you weren't sleeping well.
Well, actually, George, it's not necessarily about sleeping well. It's more about waking more rested. As you may know, I've been treating snoring and obstructive oral sleep apnea in my practice for about the last 8 months or so. I've been studying this condition and how to treat it for about the last 3 years. And through my studies, I started to wonder about myself and whether or not some of the conditions that I felt that I suffered from were related to obstructive sleep apnea. So in December, I went to the St. Rita's Sleep Center and had a overnight sleep study performed and found out that I indeed do have obstructive sleep apnea.
Really?
And what that means is I have a mild form, and so about 12 times an hour, I'm not breathing during the evening. Now, if you're a moderate or a severe, some of the severe or obstructive sleep apnea patients aren't breathing as much as 60 to 90 times an hour.
Wow.
That means every 45 to 60 seconds they're not breathing during the evening. And so I was thinking back on my life, and I realized that ever since I was a child, I always had problems getting out of bed. I was falling asleep in class.
Right.
I was always running late for something. And I always felt unrested during the day. I used multiple cups of caffeine or coffee to keep myself awake. I also was a constant tooth grinder. In the past, we've talked about grinding guards to protect your teeth. And for about the last 20 years, I've focused on trying to stop grinding of my teeth. Well, I discovered that many obstructive sleep apnea patients are grinding their teeth to try to open their airway. So recently, I began to treat myself with an oral appliance. Now, there are two types of treatments available for obstructive sleep apnea, a CPAP machine and also an oral appliance. And I've begun to treat myself with an oral appliance in the last 2 months, and I feel better than I ever have. I no longer drink caffeine during the day. I've lost 15 pounds, and we have begun to implement this fully in our office, and it's just amazing the results that are happening. We will be talking more about this in the next episode.
Well, thank you very much for sharing that experience. Anything?
Well, in addition to that, we've purchased 2 additional practice locations in Spencerville and New Bremen, and we'll talk about that next week.